My name is Isha John, and I'm the Director of Pharmacy at Howard County General Hospital. One of the most important things that patients should know, as well as families when they come into the hospital, is to bring their medication list. Bringing your medication list is just as important as bringing your insurance card. Make sure you have all the proper information in terms of the medication name, the dose, the strength, the frequency, and why you're taking it. This is one of the most critical steps when you're admitted into the hospital. So in general, we prefer that you don't bring your medications into the hospital, and that's really for your safety. Within the hospital stay, we're able to get the information that we need through talking to you, your family members, but also your outpatient pharmacy where you usually get your prescriptions filled, so we can have a complete medication history. Now, with that said, there are rare circumstances where we can ask you to bring in your medication if it's something that we don't carry within the hospital that's specialized for your treatment. So there are various safeguards that we use to make sure that the right medication gets to the right patient. We have barcode technology that we implement in various forms. For instance, we make sure that nurses are scanning the medication and also scanning the patient's unique ID wristband to make sure the right patient gets the right medication. We also have the complete medication list and the electronic medical record as well, and that makes us sure that we have the complete review of the medications that we could verify with you or your family member. So many people don't know exactly what a pharmacist does inside the hospital. So we're reviewing your medications for each and every patient around the clock. And what this means is we're looking at the medication list and looking at your risk of falls. We're looking at drug-drug interactions, comparing it to make sure that the medication doses are adjusted for your kidney function and your liver function, and communicating this, even rounding with a team in the ICU, for instance, to make sure that your healthcare team has the most up-to-date information. We are truly a part of the comprehensive care team. It's very important to know what medications you're taking, what the side effects are, what the doses are, and really any changes to your medication list upon discharge. Another important fact is to make sure that you have a plan to get your medications filled in your community or outpatient pharmacy. One service that we do offer in the hospital, and you can let your care provider know if you're interested, is to get medications delivered to you before your discharge. That way it's a seamless transition before you're on your way home. In addition, one thing that is very nice that I personally use myself for my family is a MyChart account. And MyChart is both an app as well as a website that you can log in and register. It'll have information in there from the provider, from the hospital stay, and it's very easy to then share that information with your specialist or your primary care provider.